The DRC doctors are still trying to contain an outbreak of the disease Mpox, which has now developed a strain that appears to be more dangerous to humans. The Mpox virus is only spread through close personal contact. There have been several cases here in South Africa, but the real center of the global outbreak is in Goma in the DRC. Dr. Jean-Jacques Muyembe is a microbiologist and is also Director General of the National Institute for Biomedical Research in the DRC. Dr. Muyembe, a good afternoon to you, sir, and thank you for your time. How has the virus been able to spread in the DRC? How quickly is it moving?
Yes, Mpox is now a very big problem in DRC. And in terms of epidemiology and in terms of virus, things have changed very much. So it is a very big problem, a worrying problem for public health here in DRC.
Is it
possible? If I can give you some data. Yes, so we are living an unprecedented increase in reported cases and deaths. For example, in 2023, we reported more than 14,000 cases and 654 deaths. It gives us a case fatality rate of 4%. And now in 2024, we already reported suspected cases, more than 6,000 during the week 1 and week 19. And the number of deaths is 363. So the case fatality rate is more than 5%. So this is the worrying situation we live here in DRC.
Is it possible
and we know also the geographical expansion of the epidemic. Now we have more than 20 provinces on 26 that are affected by monkeypox. It means 81% of the provinces are affected.
And
previously, we had only the province of Equateur and Sankuru that were endemic for monkeypox. And now we have new provinces like the capital, Kinshasa, and the neighbor provinces, Congo, that are affected, newly affected. And the third aspect is the sexual transmission. Previously, we did not have sexual transmission, but now we reported sexual transmission among the men who have sex with men and also among the sex workers in Congo province and in South Kivu province. And finally, I must say that 67% of affected persons are children under 15 years of age. So this is the current situation of Mpox in DRC.
And sir, what are you trying to do to stop it from spreading? What measures, what are you doing to stop more people from getting it?
Yes, we have created a group of work that is coordinating the response. And so we strengthen our capacity for surveillance and case management. So surveillance is to detect the case and to follow the transmission from person to person, and also to detect the spillover from wild animals and human. And also we have strengthened our capacity for diagnosis. So there is some decentralization, because previously all the samples were sent to the capital here at the NRB in Kinshasa. But now we have developed the capacity in the provinces. So some provinces can also carry out the diagnosis. What we need now is to have the rapid test. Rapid test. So the remote parts of the country can use these rapid tests to detect monkeypox.
And Dr.
Yes, it is what so we are doing.
And Dr. Muyembe, the people who are dying from the disease in South Africa, the people who've died from the disease have bad immune systems, compromised immune systems. Is that happening in the DRC too? It's people who have weak immune systems who are dying from Mpox.
Maybe, but in my knowledge, we don't have a specific study for that. And also the prevalence of HIV in the DRC is very low, very low. So the impact, yes, maybe the impact was there, but it was not studied. So I cannot give a specific response to your question.
Dr. Jean-Jacques Muyembe, sir, thank you very much indeed for your time.